Next, we have Dr. Shishir Verghese. He also needs no further introduction because he is yet another smart innovator from Kerala. He has won 3 international awards this year. So I think last year it was only two. Oh, four. This year is four now. Okay. So going by that progression, every year it will be like 6, 8, 10. So I don't know, maybe in another 10 years it will be a very big number. So before he goes all international, you can catch him and get to know about how to use these smartphone image devices for ocular imaging. Over to you, Dr. Shishir.
Thank you, Dr. John, and kindly don't jinx. Okay, so I'll be talking about some couple, 2, 3 more devices. So no financial interest. So we know there are multiple devices for fundus imaging, which are the non-mydriatic and the mydriatic cameras. So you know it's quite expensive, especially the minimum base price for a fundus camera is nothing, less than 20 lakhs. So you have handheld cameras now available for 2 to 3 lakhs, and even now we have smartphone-based cameras which are available for imaging. So smartphone-based imaging has been described right from 2010, and it's extremely useful for outreach and purpose for CAMs as well as for resident education. So few previous red cams have been studied the same way how Prithvi showed, to connect the smartphone to the slit lamp, and then you can even obtain posterior segment images. Now there is a do-it-yourself red cam. There's also a Me red cam which was developed by Dr. Ashish from Lotus Eye Hospital, and also a JS red cam by Dr. Jayatra. So also Welch Allen has provided this handheld smartphone-based red cam, and also a couple of others by Peak Retina and DI. The one with the DI, the advantage was that it could view around 200 degrees of field. So even the Voke InView smartphone camera is there, but the only disadvantage is using still an old model of an iPhone, and only an iPhone SE or an iPhone 5. If you still have it, you can use the Voke InView, and its cost is around 2 to 3 lakhs. So again, useful in very peripheral health centers and all. Now Dr. John has developed his John Das Pocket foldable fundoscope, which is 3D printed, and it has a pocket for the 20D lens also. So you can connect your smartphone at the one end, and one end you can keep your 20D lens, and you can take pretty good images with it. So this is how it is. You can put it in your pocket, and you can unfold it, put your lens, put on your smartphone, and you can take images from that. So it's a low cost, ultra portable. Is it really low cost now?
After patent process, it is only 9,999.
Yeah.
Better pricing. Actually, this is the old model. The new model is 9,999. That includes inbuilt illumination, magnetic docking, and all additional features. So,
yeah. So it's ultra portable basically, and you can use it as a case for your 20D lens. So these are some of the images which are obtained from it. Now we'll talk about the trash to treasure red cam. So it's a simple, affordable, portable, wireless, and do it yourself posterior segment imaging. So you take a sanitizer bottle, make a cutout, and insert your 20D lens there. So this is how this is the video showing how to do it. So you take a scalpel and cut out the one part of the sanitizer bottle, and so that becomes your holder for your 20D lens. So now those who are using other lenses like 2.2 or even 18, 30, all these won't fit, and plus that will give more of glare and reflections. So 20D lens is the ideal to be used with the trash to treasure red cam. So again, this is the same smartphone holder which is available in Amazon, and you can connect it to the sanitizer bottle. Put in a chart paper to reduce the amount of reflections. A black chart paper is preferable. And now it's ready. So this is a universal smartphone adapter, and it's available for 490 rupees in Amazon. Yeah. So the principle is the same, like how you do an indirect ophthalmoscopy. So instead of having your smartphone replaces your eye, so in the same way, the smartphone takes the image from the posterior segment, and you get the image with which the video based, you can take the image on the smartphone. So you need to do a video based, you need to do a video based imaging. A photograph won't suffice. So dilatation is important, dark room is important, supine or sitting you can do it. Support the device with your index finger, and then your smartphone you can focus it manually with your hand, and you can get good central images. For peripheral images you need to ask the patient to look up or down to get the images, and the image recorded is inverted and laterally reversed. So there are few apps which are available which you can use to enhance the quality of your images. So these are the T3R in action in peripheral centers, in CAMs, ICUs, bedridden patients. For all of them, you can utilize this trash to treasure red cam to obtain good images, and it's also useful in ROP screening as well as diabetic retinopathy screening cams. So these are some of the few images which are obtained with it. You can see multiple images: macular scar, coloboma, diabetic retinopathy, myopia. All this can be, posterior good images can be obtained with the trash to treasure red cam. So there is a small learning curve. You'll soon learn to, once you start using it, you learn to hold it with your hand properly and adjust it, and so that you can get good images. And you should know that the smartphone flash should be coaxial with the camera. Otherwise, the images will be really dull, and they won't be having a good resolution. So it has been used to study in diabetic retinopathy cams, and grade it mild, moderate, or severe NPDR or proliferative DR. And you can see good quality images can be obtained using this very cheap tool. And then you can forward it online and show it to your peers or your colleagues, and forward it to your seniors and ask what is the next line in management. So it's a big handy tool. Especially when it comes to CAM screening and all. So it can be used for diabetic retinopathy, glaucoma, in pediatrics teaching, as well as in emergency medicine. Sometimes they call you to the emergency medicine to see for papilledema and things like that. And also in ROP screening it can be used. So advantages, so both photos and videos can be obtained. Non-expert examiners can use it. So it improves the cost effectiveness, affordable and portable, and examination of immobilized patients, and also for telemedicine and teaching. So some few disadvantages: the small learning curve, like I said, there may be a glare which is caused by the tilting, or if you use a lens other than 20D lens. So next we come to smartphone aided cobalt photography. So we know that cobalt photography or cobalt imaging is important. I mean, fluorescent imaging and staining is important for corneal pathologies. So instead of taking pictures on the slit lamp, we have developed cobalt photography using the smartphone. So you use a cobalt filter and attach it onto the smartphone camera, and then utilizing the same principle of ASPE, what Prithvi showed in this presentation, you can get multiple good images of all corneal pathologies. So you can see the first one, it's like corneal epithelial defect or recurrent erosions. Then these are corneal filaments. This is herpetic keratitis. Then you have in this image showing Siedel's positive Siedel's test or leakage. And it can be used over your central smartphone cameras, or also in your peripheral smartphone cameras. So next we come to the retinoscopy. Now, who ever thought that you can teach retinoscope using a smartphone? So refraction, I have not been taught refraction. I'm pretty sure most of the PGs who are there now, optometrists do the refraction for them. And so this is a good technique, or a smartphone based technique of learning refraction as well as teaching refraction. So objective refraction is skill dependent. You don't get a live demo. Whatever the examiners see, you don't get to see it. And that's where the smartphone comes in and plays a role in helping you learn refraction. Yeah. So you know that with movement reflex, against the movement reflex, all these things, you don't actually witness it when the person does it. You have to, like, you do it yourself, and then you have to ask your seniors as to what did I really get. Did I get a with movement, or did I get an after the movement, or did I get a scissoring reflex? We don't know. So that's when you have a smartphone. So we combine the smartphone with the gimbal. Now gimbal is a device available on Amazon, as well as it's similar to the smartphone adapter, and we attach the smartphone onto the gimbal, and the gimbal is attached onto the holder or the retinoscope. So this is how we do it and construct the gimbal scope. So we take the retinoscope, attach it onto the gimbal. and your gimbal scope is ready. So now utilizing the smartphone itself, you can see real time. When the examiner does it, and if the smartphone is attached, you can see real time the reflexes obtained during your retinoscopy procedure against the movement. And you see how they neutralize it. So all this is observed by the trainee live while looking at the smartphone. You can obtain the scissoring reflex. So initial assembly is there. There's a learning curve, and sometimes it's difficult to access to the focusing sleeve. So gimbal scope is a frugal, do-it-yourself, and refraction technique. And you can do live demo recording, and then you can, once you have the smartphone, you can discuss it with your peers and see the kind of reflexes which are obtained. Yeah, thank you.
Thank you, Dr. Shishir, for that innovative talk. I think a lot of people in the audience have their minds open to the possibilities with smartphones. I think many of you, most of you have hated refraction, and many of you who love refraction hated that the others whom you wanted to teach it to hated refraction, and this is a method to teach refraction. You can put your smartphone onto your scope and teach refraction so that you can show how it actually is seen. So over to you.